Good afternoon, everyone, and thank you for the opportunity to present EYEYON Medical. I'm Anat Lemzen. I'm the Director of Medical Affairs and Product Manager of HyperCL. We at EYEYON Medical are focusing on answering the unmet need in corneal pathologies. We have two innovative products. You've heard today about the EndoArt, and I'll be focusing on the HyperCL. As we all know, less than 5% of the administered drugs are absorbed by the cornea, and it leads to increased treatment time, decreased drug effectiveness, and it's also very much a burden to the patient. If we want to improve drug delivery for faster healing of the cornea, we better use a drug depot contact lens. And for that, we developed the HyperCL. It's a therapeutic soft contact lens that acts as a drug depot, enhancing the bioavailability of topical drops. The leading indications that we chose to focus on that require a megadose to the center of the cornea are corneal edema, infections, and severe dry eye. This alone products a market of 19 million potential patients for HyperCL. So let me tell you about what the patients experience and how the HyperCL can help him. Patients experience blurred vision, pain, or foreign body sensation. Then he comes to the doctor or the ER and diagnosed with infections, severe dry eye, or even epithelial defects. And the physician can treat him with two options. One is drops alone, and the second one is HyperCL with topical drops for better bioavailability. So let's see how the HyperCL works. HyperCL and the drops are prescribed by the physician, who instructs the patients to first apply the lens and later apply the drops. It can capture any drops that apply to the surface while in the eye and hold them for a long time. The reservoir fills up and the eye recovers dramatically. HyperCL is an FDA-cleared product. It's also approved in across America, Israel, and Latin America. It has depot capability, which reduced pain, treatment burden, and shortened the healing time. I want to share also clinical data that improved patient life, and the first one is for bacterial keratitis. It's a condition that patients suffered from strong and acute pain, and this condition required a megadose of antibiotics to the center of the cornea. Professor Raj conducted a study in India, and he proved that after only 12 hours of treatment, the arm that used the HyperCL showed faster healing and reduced pain. Another important use of HyperCL is for a very common indication that we are all familiar with, severe dry eye, treated with serum drops. We see patients improving from being legally blind to being able to function. The creation of the reservoir, as you see in the image, while using the HyperCL is 14 times thicker than the control, providing additional hydration and protection over time. Even infants can be treated with HyperCL. This is a case series conducted in India. Infants who were born with sclerocornea underwent a corneal transplant, and in these cases, the lens protected the new cornea and transfers drops to preserve it. You can see in the left images that how it helped to keep the sutures in place and at the same time to transfer the drugs. The new interesting indication is for neurotrophic keratopathy. It's another indication that we had for the last a year, which is an absence of corneal sensation leading to the development of corneal ulceration, melting, and even perforation. This case is published in the Cornea Journal, showing that the HyperCL with insulin drops helped save this patient cornea, and it was within only 20 days. Looking forward, we successfully brought this innovative HyperCL to be an approved working product. We are now looking for a potential partner to bring it to the world. Thank you.